Welcome to Office Hours. Whether you're new to the acupuncture profession or have been at it for decades, this is the place where we discuss all things Chinese medicine and more. Join Toby Daly, a seasoned acupuncturist of the Som tradition, and Angelique Britt, a nurse turned acupuncturist who is brand new to the field, as they explore topics in and around the world of acupuncture and Chinese medicine. There's something for everyone here. Drop in anytime.
How cold is it there?
How cold is it here? 40 degrees, so it's not bad.
40
Not
degrees.
bad.
It was 37 here today.
Yeah. Wow. Colder in
Do you feel bad for
California.
us? Do you feel bad for us?
Not even a little bit. Sorry. I have no
Okay.
compassion for that.
It seems fair. Everyone here is like,
So,
oh my God. You'd have been cracking up. Everyone here today is like scarf and
yeah.
hat and just all like curled over.
Meanwhile, all the New Englanders were like, oh. So I have an update. I decided to make some changes to business practices. I'm getting more and more used to just going with the flow and trying things and seeing what happens
Mm.
and then pivoting. I noticed that I was starting to feel a little resentful in some ways. And I was like, why am I feeling resentful? And I recognized that I was basically doing a lot of work for free and not
Mm.
realizing how much work I was doing for free. And so, how that was manifesting is um, I was trying to keep things simple. And by virtue of keeping things simple, I made things more complicated for myself. Isn't that the way things go? And so, I had just two prices. I had my initial visit price and a follow-up visit price. And it didn't matter if you're just going to have acupuncture, if you're going to get acupuncture and herbs, but just it was one-stop shopping, one price, easy peasy. That's what I thought. And then I started taking insurance, and insurance reimburses on various levels and scales, and there is no insurance reimbursement for any of the herbs. And so no matter if people were private paying or people were using insurance, the cost of herbs was always extra. And because of how I've chosen to do herbs, which is the raw ground method, Sharon Weizenbaum does this. And there's actually a really great video on White Pine Circle about the thermos method of
Mm.
using raw ground herbs. I think the acupuncturist name, and I'd have to double check it. It's Evan Aaron, I think,
Mm.
if that sounds familiar.
Link up here on it.
Yeah, it's like an hour and a half course. Really, it's cool to listen to if anyone's curious. But by doing that, you can make herbs really low cost, which so far for me has increased compliance. And because I'm a new provider and, I don't have all of the confidence of I'm going to knock it out of the park with the herbal medicine,
Mm.
it's nicer for me to be able to offer a lower cost, both for accessibility and for the ability to have a little freedom with experimentation is not the right word, but with learning, I guess, the trade on my own. And so I was putting so much time into figuring out the formulas and researching the formulas and grinding the formulas. And so I realized I was doing a lot of extra hours, particularly with the herbal patients, that just wasn't being reflected in anything. It was everywhere. And so I decided to make things a little more complex in terms of what I offer with the hopes of making things simpler and to compensate myself for my time in a
Mm.
more fair way. And so I now have three different tiers of offerings. So you can get just acupuncture, you can have just herbs, or acupuncture and herbs. And I'm going to see how this goes. And this has different pricing options. And then I decided that if you're going to use insurance to pay for your treatment and you're interested in herbs, that there'll be an extra like processing and preparation fee
Yeah.
that I'll add on. Which is, I checked with my biller, who we will eventually talk to on here. That's okay to do. Like, you're not going to get in trouble with the insurance company if you do this, because it's not something that insurance reimburses for anyway. And so that just felt better overall. And so I have rolled that out this month. And we're going to see what's happening. And although I can't share the identity yet of this person, I'm going to have another acupuncturist joining me.
Oh,
So
great.
I've been working on doing like physical updates in the space that I currently have to make space for us to be there. So I will be able to double my treatment space which is great. So I'll go from having two beds to four, and I'll start I haven't done this yet. We're in process. I've got all of the materials. I just have to have my very handy husband install some of the things that are required. And then I'll start using some of the space for overflow people or the last minute folks that I'm actually starting to have trouble fitting in a timely manner, which I guess is a
Hey,
good problem
nice.
to have. I mean, I'm not fully booked forever for months, but for new patients for that block of time that I establish for a new visit, I have a couple weeks out that before I
Great.
can fit someone in. So that's been neat to
Yeah.
experience. So yeah, those are my little updates, and I share for both transparency and just because I'm why not? I'm sure I'm not the only one that's trying to make it on their own out there in the
Yeah.
world in our profession.
Yeah, I remember that, especially like researching herbal formulas, right? You could spend hours on just selecting a formula. So you have to get some kind of compensation for that. So especially that you weren't compensating yourself at all, I think
Not at all.
that's really reasonable to bring that back in.
Yeah.
I think you're going to really enjoy having more than two rooms. You're seeing two patients now, or is that right?
hmm
Yeah,
Yeah,
but so
I kind of. I have a sort of
okay,
hybridization of that.
right.
I
Tell
slow so my hybridization is so if I have an hour's block of time, I will see one patient and then the next one a half an hour. But at the end of that second patient, I leave a gap of 15 minutes before the next
mm,
hour starts. And that's because I'm by myself. And so I have to, change the table linens and make sure the trash is picked up. And if there's an herbal formula that has to be actually
right,
physically made, I have time to do that. If someone needs a little bit extra time, I'm not feeling so stressed that there's someone waiting in the waiting room for the space that I'm currently
right.
occupying. So it allows a little bit more breathing room and is easier on my nervous system to
Yeah.
have it this way.
I think that's really reasonable. I think it might be nice if, well, depending on if the other practitioner is using it, though, it's really nice to have a third room because every once in a while you need that. You need to squeeze someone in, some
Mhm.
emergent thing, or someone just needs extra time. It's really nice to have that third room. So I think I told you I used to do 5 rooms. That was insane. But 3 rooms is nice because 2 rooms is pretty, anyways, especially I see two patients an hour now at this point, and that's really easy. But it's nice to have a third room every once in a while when always stuff comes up. So
Yeah, stuff
again,
comes up.
you have to squeeze someone in, someone needs extra time or something like that. It's really nice to have that third room.
Mhm. And the scheduling pattern, I'll give credit to my friend Nina, who's also an acupuncturist
Hmm.
in, the Jamaica Plain area because she showed me and I was like, "This works." I had my thoughts were in knots over how to figure out the whole scheduling thing, and this has been really nice. I did try doing the every 30 minutes seeing a patient, and especially with just 2 rooms available, that I did not like how that felt for me.
Yeah,
I felt stressed all the time, and I was like, "I am not working in nursing for a reason anymore. I don't wanna feel like
right.
this." It felt too reminiscent of, like, the pressure I would feel, working in the hospital, so
Yeah, but especially when you get at some point when you get help at your clinic, right? You'll find
Mhm.
that's really comfortable. Two patients an hour is really comfortable with someone else taking care of everything. It's just really nice.
Also, I'm checking people in and checking people out and taking the
Yeah.
money, and I do hate taking the money. It's the worst.
Mm,
I've actually started to say to people, like, "My least favorite part is taking your money, but unfortunately, it's something I have to do, and so this is how much it is for the day," or
yeah.
adding some little joke or something along with it, because I feel very supermarket checkout,
Yeah.
at the end and being like, "That'll be X amount of dollars today."
I
Like,
really,
"Okay."
I really feel like you have to split this between two different people, right? That the high level clinical work, you're
Yes.
trying to people get their best possible state of health, and then someone else to manage the financial part of that, that
Yes.
you just clean the linens part of it, just all that kind of stuff. It's really nice to split that between two different people rather than one person going from that really high level clinical work to other things, again, like more mundane kind of things. Yeah, again, I never figured out how to do that myself, and that's why I hired somebody because I just couldn't. I just never felt comfortable doing that, switching those roles.
Once I get to a place where the volume feels pretty steady and I have, like I've got pretty right now, I'm almost fully booked this week. Like I had like one, I think, open visit. And next week it's like I usually have one or two, sometimes three visits still open, but up to 3 weeks, like 3 weeks out, I'm half full from now.
Okay,
Do you know what I mean? So that's pretty cool. That's exciting.
this is that new problem I was telling you about. Then
Yeah.
when people just again, it's nice too. You're not jam packed too because again, emergent patients. I always do this when my schedule is all the way full, but something emergent they really need help. I just put them in. And so if you're not jam crazy packed already at that point, then that's really helpful. But
Mhm.
even when I'm pretty full, I still see those kind of patients when they just really need something.
Yeah, I've had that happen where I've tacked them on at the end of the day because that's the only
Yeah,
time I've had the space, and I don't have the problem of, like, being booked forever and ever, no, I have no space for you yet, I don't have that problem
yeah.
yet, but when I get to that point of being, I don't even know what the threshold would be, but enough predictable volume that I can substantiate another person that I can pay on a regular basis. That's not piecemeal, that I can train and like have. Yes,
Yeah.
I absolutely want to be able to do that. I just don't feel like I'm at that financial stability place yet where I can do that and pay them well. Right?
Yeah.
I don't want to not pay someone well. So if I take someone on, I want to make sure that I can give them a good wage, not just a fair wage.
Yeah, that's what I'm doing, and especially I've had all kinds of people help me, and then especially people that sometimes the people that came to help me made everything worse. So you
Yeah.
have to be really careful. So you have to get the right person and then compensate them well. I just can't recommend that highly enough. So if something again, just in case anyone's hearing this, right? Somebody that's there to help you and is not working out, use me as an example and let them go sooner rather than later because I just always went too long for those kind of things. And then you get somebody amazing, which I have somebody amazing with me right now.
Yeah.
And then yeah, you compensate well and then just appreciate that it's so great to be able to do those again because it's really two different jobs. And so it's really nice to have a second person doing that other part of that job rather than all for you.
Yes, I look forward to that day. It's
Okay, yeah.
coming. Figuring it out.
It's coming pretty quickly. It's just a little past a year in, so congratulations. I'm really glad everything's going so well. Again, there's so much healing that needs to be done in this world, so it's nice. It's nice people recognize that and coming to see you. So
Mm.
congratulations.
Yeah, I don't feel like I should be throwing myself a party just yet, but things are moving in the right direction.
Yeah,
Things,
there's no guarantee of that, right? And
no.
you got your training and you open
Yeah.
your door
Yeah.
and then yeah,
Then you
that's nice.
pray.
You pray and you hope, right?
Yeah.
And then it's nice. Again, if you can help somebody, they're going to tell 20 people.
Mm-hmm.
So that tends to go well.
Yeah. Yeah.
Okay, anything else for today you want to discuss?
Well, I actually this just actually I remembered this suddenly. I kind of wimped out on the system. I have definitely have been carrying Phillips and your words with me around trusting the
Mm,
system, and I totally wimped out. But I want to return to it. With there's a patient that has a really interesting issue. So I'll tell you about it from memory. So forgive me if I don't have all of the
yeah,
details.
that's fine.
So as a patient in their 60s, male patient, thin and wiry, I can't quite. I think he's more of a large intestine body than stomach excess body, like more large intestine, but could be a little stomach excess. His behavior, he's very busy, has to be busy all the time. He's retired, but volunteers 5 days a week, really enjoys it. And his main complaint is that he has this feeling of that his feet are full of sand. They're just sandy feet. He has full sensation, but his feet are full of sand. And at nighttime, especially after a day of activity, they'll really hurt and he'll have to get up and walk around. And he also has the most curious of the symptoms is that periodically, unpredictably, he will get these red spots on one or two of his toes on each foot that start to tingle. Like he'll get a tingling and the spots will become red and they'll open up and become sores. And so when he first started, he started coming a few weeks ago. So we're on our second, third treatment, maybe. Didn't have any of these spots or sores. And between the last time I saw him and this time, he mentioned he had a tingle and then he has these red spots like on the tips, just under the toe tip. Like if I can't remember the what is it? I can never say the Chinese word, but the tips of the fingers. If he had the tips of the toe points, they're just below those points. So
Mm,
on the second and third toes, so like stomach channel maybe, and they're blanchable because I check. As a nursing thing, if tissue's blanchable, it means there's circulation that's still coming to the area, and if it's not blanchable, it usually means that the tissue is gonna die. It's like a pressure
mm,
sore, and I'm like, "Are these pressure sores?" Very curious, not tender to touch. Okay, so I treated him with traditional Chinese medicine style acupuncture, moved the needle on 0 things. Okay,
mm,
he came back. And so when he was talking about sand, and I already know this was not correct, that I shouldn't have done this, but I did this anyway. I was like, "Well, it's a deep, like, could sand be numbness? Is it a deep numbness?" So despite that he has a more of a large intestine constitution, I did supplement the large intestine, and he was fine on the table. Didn't do anything. Like, and like nothing. One of these patients where like nothing is moving. I was like, "Are you sleeping any better? Is your appetite any better?" And in terms of like other constitutional things, he tends to run on the cooler side. Skin is normal. It's kind of like kind of dry, like not super dry, but not super moist, but like on the drier side. Digestion's fine. Appetite's fine. Energy's pretty good. He has some kidney chi deficiency stuff. So he's got, he has a frequent clear urination, has some incontinence, multiple voids at nighttime. So that sort of thing. So maybe he needs heart. I don't know. So I went back to traditional Chinese medicine style acupuncture and I did Bafeng. And he felt very much of the energy going to his feet as one does with Bafeng. And I
Yeah.
don't ever lead with Bafeng, just like I don't lead with Som a lot of the time, just because of the intensity of the needling. And so I don't know what the effect of this will be, but this is one of those patients like the needle is not moving at all, and so I abandoned ship with large intestine because I realized after that visit I was like I probably should have done something different, like maybe he needed spleen, and then I was like, what could I do spleen?
No, but maybe even spleen, especially the sand sensation with dry on the inside and slightly dry on the outside, then I would consider spleen better for that. Yeah, I don't think about sand as being like a numbness.
Think of it
Uh,
literally as dry sand.
could be. I mean,
Kind
especially
right.
especially if they say it like that, I would
And like
consider.
heavy, but there's like a heavy sand. It was like heavy, like these feet are full of sand. So it was like heaviness, that dampness.
Yeah, yeah, would pull me away from spleen there, but I definitely wouldn't go to large intestine for that kind of presentation. Yeah, while you were talking about it, I again, except for the fact that he's having a little bit of incontinence, I like small intestine for that kind of thing, right? Kidney channel going right through the bottom of the foot, and then getting a lot of movement for that sand. That's reasonable. Any
And also I thought,
varicosities or anything like that on?
no, no,
I'm hesitant with heart because of the red spot
the red.
on the toes. That's a reason not to do it, right?
And then I was wondering about stomach because he has some congestion, like he kind of has a chronic runny nose situation that
Hmm.
happens worse in winter. And so because the toes affected are the second and
Yeah,
third toes, I was like, could we supplement the stomach? So
yeah.
it's one of
But
those things where it's like, I think if I'm going to do it, I'm going to commit and we're going to just stick and trust the system. Oh.
maybe supplement the lung, right? Because it's better for body type. If he's
But he's
definitely dry on the inside and
no, but he's
slightly,
the runniness of the nose. I was thinking of wet on the inside.
is
His
that on the
his bowel
inside, the
movements and
nose?
digestion
Is
doesn't
that is
have.
that is that in the inside of the nose? Is that definitely inside?
I mean, it's coming from sinuses, which are.
I'm
This
not
is what messes
convinced.
me up. So you think of runny nose as outside wet.
Sometimes I do.
So of course, it depends, right?
Right. No,
Of
no,
course.
frustratingly, but that's what I do, right? But
Yeah.
especially the body type has much more weight for me than is that runny nose inside or outside, right? The body type definitely is inside and the
Okay.
skin's definitely outside. So you can
Yeah.
see, especially if he's really skinny,
He's
then
thin
I know, but so I'm just much more likely to supplement lung for that kind
lung.
of case.
Okay. Okay. This is why we're talking because yep, if I'm going to commit, we're going to commit. I don't
Yeah,
think there's
but
any. I don't think there's any other details that I've left out or missed that are significant. Other than like he's got kind of a liver excess complexion.
what does that mean?
He's like like it's like a dark sallow. He's just like
Mm,
dark. Like it's just there's a darkness. Not in his energy per se, but like in his face. If I
I
were
mean,
thinking of it in like the four humors, he'd be melancholic. It's
okay.
just like he's got that sort of look.
Yeah, that's great to recognize it. And then maybe the lightness of Sanjiao might help with that heaviness in the feet.
Mm, okay, so I
And
have
that
some
that you
options.
especially we could say that might be heat below with the red spots down below.
Oh,
You know,
yeah.
so again, I'm just always trying to what's the body trying to tell us it needs? So
Okay.
especially, persistent red spots, we could say that's a heat below.
Well, it's not. It's intermittent. It's very random. It just so
Okay.
happens that it's doing right
Less
now.
weight on that then. But
Okay.
definitely that heaviness, right? It definitely has that heaviness in the feet. So
Okay. So that gives me some options I hadn't considered before. Also,
okay.
all right. Yeah, that was my. It's like wow. As I was looking at that, I'm like, how do I even interpret this? So that makes a lot of sense. I somehow forgot that, like, yeah, red spots mean
Yeah.
heat.
but like you're saying, they're intermittent, so I'm
Yeah.
hesitant to jump on that. I
And
mean,
they're intermittent in appearance. It's like once they appear, it seems that they're there and they get worse and they open and then the wounds are slow to heal. That's been his history. And so
mm,
I'm seeing the beginning of a cycle for him. So it's not like they come and go throughout the course of like a month or something. They're cyclical over like a year, year and a half. I think that 18 months was the last time he had
wow.
these.
Ask him if there's a temperature component to his feet.
Sensation wise.
Yeah, because he'll tell you don't lead him hot or cold, right? Just ask him, is there a temperature component to your feet?
Okay. That's a good way to ask it. In general, is there temperature component to your hands?
Yeah, that's it. Again, it just keeps it open, and then feel yourself too, right? That especially if you palpate the leg and it gets hotter as you get down. That's a supplement Sanjiao idea for me.
Okay. That's not something, I mean, I palpate, but it's just like if they feel warm, they feel cold. I did not consider doing it on a gradient.
Yeah, especially as you go down the leg.
Okay. That's helpful. Thanks.
Okay, good. Yeah.
Yeah,
Anyways, it's nice as we discuss stuff, then we can talk about more nuanced things. So
yeah,
thanks a lot for bringing it up.
sure. I think
And
that's
anything
all.
else? Go ahead.
No, I was gonna say that's all at the top of my mind for this
No.
moment. How about
Okay,
you?
great. I always have tons of stuff to talk about, but let's stop it here and then let's pick it up next time. Okay.
All right, that sounds good to me. We'll see you
All
next
right.
time.
Yeah, good talking to you.
All
Take care,
right.
everybody.
Bye.